likely we can shrink down that tumor. Now, it's supposed to be the only site of disease in the body. So the patient is supposed to be coming to me today, Saturday, emergently, and radiosurgery most likely will shrink down this mass, and most likely it will sterilize it. The success rate, where we aim the beam for lymphoma, is about 90%, whether it's in the brain, body, or elsewhere. And then I'll probably get a PET scan on her and see if there is anything else in the rest of her body that's whether the chemo really contained the cancer in the body, in the chest, or not. So both of these cases are cases that got a hold of the chemo people, and for whatever reason, they just said, well, for the melanoma in the brain, they said nothing can be done. But that's far from the facts. This first woman started radiation and is now walking, talking when she was comatose 4 weeks ago and going on hospice. The second woman was told she's going to die this weekend. She's supposed to be in her office in a few hours. So we hope to help people.
Yeah, I wish you the best of luck, and I hope to hear a success story next week.
Well, I hope to be able to provide a success story. But anyway, the facts are that it's very likely that we can help the second woman just like we helped the first woman. So there are a lot of interesting brain cases. I want to talk about one more brain case this morning before we delve into the rest of the body. And that is a woman, and I think I spoke about her 2 weeks ago. She was sitting in her car, remember, a year and a half ago, and got hit by a truck while she was drinking coffee. Do you remember that woman?
I do remember that story, sure.
Okay, so she was sitting in her car in New Jersey, drinking coffee, not doing anything, and a truck plows into her.
Right.
And she ends up in the hospital and nursing home and rehabilitation on a respirator for 6 months.
Wow.
And during that time, they did an MRI of the brain, and they saw a tumor in her head.
Right.
Now, do you think one person told her or her husband about this tumor in her head a year and a half ago?
I would hope so, but something tells me you're going to tell me different.
No one told her anything.
Wow.
Okay. So now, a year and a half later, she's made all this recovery, and you can imagine what she's gone through. She had both lungs collapse, she had a fractured pelvis, she was on a respirator, hit by a truck while she was drinking coffee, minding her own business.
Yeah.
And she's getting hit by a second truck, which is she was found with a tumor in the head. No one told her one word for a year and a half. Now she's got neurologic symptoms. The tumor is growing tremendously from 1 to 4 centimeters, so it's grown by about 30 or 40 times in volume. And she came to us. She went to a neurosurgeon and said, it's a meningioma. Now, a meningioma is a benign tumor of the coverings of the brain.
Mm-hmm.
I looked at it. It didn't look like a meningioma to me. It looked like a primary brain tumor, like a glioma or astrocytoma. Got a hold of 2 neuroradiologists, both of whom agreed with me.
Mm-hmm.
And, in fact, we had surgery done on this tumor, and it is a high-grade primary brain tumor. And high grade means it's a rapidly growing tumor.
Sure.
So she's going to need radiation. She made it through the surgery well. We recommended radiosurgery, which allows us to focus the treatment right on the tumor area, hit the tumor area and the tentacles, and leave the rest of the brain intact. And this is the kind of work we were first of in New York with fractionated stereotactic brain radiosurgery. So we have a whole team devoted to brain tumor treatments, whether it's meningiomas, which this woman does not have, a high-grade glioma, which this woman does have. In the first case, I talked about melanoma, and in the second case, lymphoma. So we have a well-tuned team that's been at it longer than anyone else in New York, doing fractionated stereotactic brain radiosurgery, which is non-invasive treatment. So unlike Gamma Knife, there's no screws in the head.
Sure.
There's no hospital stay. There's no pain. There's no suffering. People come in to get a treatment and go about their business. And because we divide up the dose, unlike Gamma Knife, it's much more tolerated by the healthy brain.
Yeah, sure.
There's less side effects, and there's no pain. So, again, we're here live. If you have questions, you can call us at 212-CHOICES, which is our office phone number, 212-CHOICES. We have a booklet about our brain tumors and a lot of examples of before and after, whether it's pituitary tumors, meningiomas, acoustic neuromas. We have the world's largest experience treating acoustic neuromas. 250,000 Americans have cancers that spread to the brain, like the first woman I talked about, melanoma, that spread to the brain, or primary brain tumors. So there's a lot of information that we have available, and there's a free booklet DVD if you call in and leave your name and address. So we're going to hear from the man with the golden voice, And then we'll be back with more interesting cases and to answer your questions today.
And give Doc a call. We are here live, so 800-848-WABC.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. At Radiosurgery New York, the radiosurgery pioneers, that's our goal too. We're first in America, first in New York, first for you with body radiosurgery. We hit your cancer from head to toe with no cutting, no bleeding. We have decades of experience with primary and metastatic, large or small cancers. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are the best results and quality of life. Hi, I'm Dr. Gil Lederman. For a free booklet and DVD, call 212-CHOICES. 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. We're super convenient, Broadway and 38th in Manhattan. Hyperthermia 2. To hit your cancer, call 212-CHOICES. 212-CHOICES for Radiosurgery New York. At Radiosurgery New York, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Custom prostate cancer treatment here is outpatient and takes as little as 1 hour. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Hi, I'm Dr. Gil Lederman. Call us at 212-CHOICES, 212-CHOICES for a fresh second opinion and a free booklet DVD. Conveniently located in Manhattan at 38th and Broadway. For your custom-tailored prostate cancer treatment, call 212-CHOICES, 212-CHOICES. Cherish your life with custom-tailored prostate cancer treatment at Radiosurgery New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
We're back. We're back live. We're happy to take your calls. We just got a call. I got cut off, so I apologize, but you're welcome to call us back if you want. An interesting patient who came in yesterday, a woman who's about 80. She's Jehovah's Witness, which is people that don't want to take blood. So
Sure.
She's very reluctant to have any blood products. Actually, won't have blood products. And she went to another hospital and was found to have a cancer in the biliary tree. Whoops, we have a call. Let's get this call. 1 minute. Hi, you're on the air. It's Dr. Lederman. Good morning.
Good morning. This is Eileen. How are you?
Fine, thank God. How are you?
Pretty good. I just wanted to say once again, I'm your patient. I've been your patient for 2 weeks. I'm about halfway done. How impressed I am with the staff and the attitude and the time that is given to me. Unfortunately, I have to say that while you would expect this in other places, the care in this country has gotten to the point where you feel abandoned, neglected, that they're doing you a favor by taking time with you. And your office is nothing like that. I'm much more pain-free in 2 weeks' time, and I cannot thank you enough for the hope that you've given to me.
Well, I hope we've given you more than hope, because when you came to us, you were having these obstructions, right, and pain and having trouble eating. Mm-hmm. And you have a cancer that's blocking the intestines, correct?
Yes.
And we found these cancers that were growing and kind of strangling the intestines, right?
Yes.
And how many treatments have you had now?
I've had 6, and I have no more pelvic pain, and it was to the point where I could hardly get up off a chair without being in complete agony. That's all gone.
And you were also having trouble eating, right?
I couldn't eat almost anything.
So tell me what's happened.
That went on for a month, and I went back to the surgeons I had, and they basically said, well, we don't really see anything. And then in an hour and a half, an oncologist said that I had 2 months, 6 months to go.
And what did they offer you?
Chemo.
Kemosabe.
That's right.
But